introduction of yourself, your education background, and what you are working on right now in your career? That sounds like a lot, but just briefly introduce yourself.
Sure. So I'm David Janiczek. I'm currently a fourth-year anesthesia resident and chief resident at the University of Illinois, Chicago. In terms of education, I went to the University of Iowa for both undergrad and med school. I studied integrated physiology and business administration as an undergrad, and I graduated from medical school in 2017. Next year, I'll be heading down to New Orleans to do a fellowship in cardiothoracic anesthesia. Kind of when I'm not in the hospital, doing my residency duties, I started a company back in 2018 called GetAdmittedMD. It's meant to help students, understand the pre-med process, understand the medical school admissions process, everything like that. So I like to help students kind of navigate that tedious process and help them be successful on their medical school applications.
Awesome. Also, it's called GetAdmittedMD, right?
Correct.
Okay, so I went on your website. I'm going to ask you, but throughout the interview, I'm going to ask a couple questions about that. Sure. Our club is focused on educating people about different careers,
Sure.
But it's also useful that you have so much knowledge in the admissions process. So since this is for high schoolers, so we're going to veer towards talking about your career specifically and talking about college admissions as well. Awesome. So first of all, just a general answer. Why did you decide to go into medicine?
So yeah, it was actually an experience I had growing up with one of my family members was sick, and they had to have surgery, and so it was actually that experience that kind of sparked my interest in medicine in general. And then I fell in love with anatomy and physiology. While in high school, I took an anatomy and physiology course and really developed a passion for it. Along that, I also took I took an opportunity through that course to shadow an anesthesiologist, and that's really everything kind of came together. And just the way they use anatomy and physiology, pharmacology, all those sorts of things in the operating room, really just inspired me. And so it was kind of a combination of all those things. And then, when I was in undergrad, actually, when I was a sophomore, my dad had some cardiac issues, and so he was, battling those, and that kind of reaffirmed everything that I was thinking up to that point, and really kind of further motivated me to become a physician.
Awesome. It's important that you mentioned shadowing, because I know a lot of high schoolers are really unsure in which direction they would like to take their career. And internships and that kind of stuff is up for grabs, and there's not as many, I guess. And I know people who do pursue internships are way more direct in where they want to go. So that's also something we'll touch on later. Sure. So we understand that you're an anesthesiologist. Could you summarize your job or career path in a couple of sentences?
Sure. So basically, we allow surgeons to do what they do. And so without anesthesiologists, surgeons really couldn't operate. And so, we provide many things to the patient: pain control. Basically, we put patients to sleep for surgery, and allow them to undergo these surgeries that they need. And so, we're there to basically take care of them and make sure that they survive the surgery, from a physiologic perspective, and make sure that the surgeons are able to do their work, to patients that laying still, patients that not feeling pain or anything like that, and then is also asleep.
Awesome. So you kind of already touched on this already, but why did you decide to pursue specifically anesthesiology?
Yeah, it's a great question. So there's a lot of reasons. One of them, I kind of mentioned already, was the love for anatomy and physiology and pharmacology, and just being able to manipulate those variables in a real-time, manner. So I never wanted to be the physician that saw a patient in clinic, told them to come back in 3 months and see me, and then give them medicine. I never wanted to do that. So I wanted to have a direct impact on the patient's medical course, and so there's no real better example of that than anesthesiology. We see a lot of different changes in physiologic parameters, and we can give medicines to then counterbalance those. So, it's a very rewarding, very, I guess, immediate gratification type of experience. And so, that was something I was definitely looking forward to. There's a lot of variety in anesthesiology. So, one day you could be working with cardiac surgeons, one day you could be working with orthopedic surgeons, the next day general surgeons. So you can basically do any type of anesthesia that you want, and work with different groups of people. So you do have to kind of know a little bit about each type of surgery and the physiology involved, everything like that. And so that definitely keeps it interesting. And then there's opportunities every single day to do procedures. So whether we're intubating, placing IVs, placing central lines, placing epidurals for patients in labor, all those things we're trained to do. And so that definitely breaks up the day and makes it fun. And then lastly, this could be viewed as kind of a positive or a negative, but based, the fact that there's not much continuity of care in terms of, anesthesiology, we don't see the same patients a whole lot. A lot of physicians would say that's a negative. Personally, I wasn't necessarily looking for developing the long-term relationships with patients that other physicians may. And so, I was definitely okay with that. And, I think it's a perk actually. And you see new patients all the time, you meet them, have to gain their trust, and then, move on to the next patient. So, for me, that works great, but I know for other physicians, it may not.
That was a great answer. So I know Yashma wanted to jump in with something. So go ahead.
Yeah, so like I know there's like stereotype the anesthesiologist is like high pressure and like stressful. Like, do you agree with that?
Oh yeah. So people have said, anesthesiology is, 97%, chill, but then 3% complete chaos. And so, I would definitely agree with that, sort of statement. It varies between 97 to 99% and, 1 to 3%. But the fact is, most of the time it goes very smoothly. And everything's very, by the books. However, there are times when it can get very stressful. And, you kind of have to be able to turn that part of yourself on and then turn it back off. So, it's not high intensity all the time, but at the same time, you have to be able to, step up to the plate, if you will, and be able to turn that stuff on and take care of the patient in those moments.
So when obviously we just talked about like what made you want to go into anesthesiology specifically, did you have any concerns? I know a lot of people when they go into medicine, they have concerns about where the long journey, the time commitment. Did you have any concerns about going into anesthesiology specifically, whether that has to do with your mental health or something else?
There's always been the certified registered nurse anesthetist debate, the CRNA debate in anesthesiology. When I was a pre-med, people were talking about, oh yeah, CRNAs are going to take over the field and, there'll be no jobs for anesthesiologists. And that really hasn't happened. CRNAs definitely have a place in anesthesiology. And, I think they're very valuable. However, are they going to take all the anesthesiologist jobs away? I don't think so. At least, not in my career in the next, 30 years or so. And so, that was definitely one fear. Another, kind of fear about anesthesiology is that, overall, are there going to be machines that take over, and it's not a human anymore. It's a machine that's going to be providing anesthesia. And once again, people have tried doing that and it hasn't really panned out to the way that, people have thought. So, will that, come in the future? Maybe. But, I think there's still a lot of time to have a really great career in anesthesiology. And so, when I look at everything put together, I still am very positive and, optimistic that it's going to be a great field for, 30, 40 years still.
This may be a dumb question. This is the moment where you realize that we're freshmen in high school. What is a CRA?
Oh, sure. So a CRNA is basically, they also refer to them as mid-level. So they are nurses that go through, nursing school, and then they typically do a 1 to 2 year critical care nursing job for, an ICU setting of some sort, and then they apply to what's called CRNA school. And so what that is basically these individuals are trained to provide anesthesia, but in most states, they have to work under an anesthesiologist supervision. And so as an anesthesia resident, basically, we'll do 4 years of anesthesia residency, and then we'll become a full-fledged anesthesiologist, right? The CRNAs may not ever get to that point in terms of, practicing 100% independently. They may always have to go on, kind of speak to an anesthesiologist about everything. And so they are great in terms of providing, care and increasing the workforce for, providing anesthesia to more patients. And in some states, they are allowed to independently practice. However, a lot of states, they still have to be under a anesthesiologist. And so, the debate has always been whether or not they would take over the field of anesthesiology and be able to, basically force out anesthesiologists. But like I said, I don't think that's, in the next, 30 years going to happen. I think there's going to be a place for everyone to kind of practice, and, what that system will look like in 20, 30 years, I don't know. But, like I said, I'm optimistic.
So for a CRA, obviously, I don't know if you know this, but what is the education required? What is the background required before you can start working?
Yeah, so it's 4 years of nursing school. So that's basically a 4-year nursing degree. And then you have to do 1 to 2 years of critical care nursing. So what that means is you're working in an ICU setting for 1 to 2 years. And then you have to go to CRNA school, which is, depending on the school, 2 to 3 years. And so, it's slightly shorter than, becoming an anesthesiologist. But at the same time, there's a little bit less stress overall. Especially if you're in a state where you have to work under an anesthesiologist, because they're basically ultimately responsible for everything. So, there's a little bit less liability, a little bit less debts, but going along with that, there's a little bit less training. And so, it's when you first come out of CRNA school, sometimes you're not comfortable with everything. But you get comfortable with most things versus, typically anesthesia residents come out, pretty well trained in most things, if not everything. And so therefore, there may be a little bit more comfortable with everything, coming straight out of training.
So Shreyant had something to say really quick. You can go ahead and do that.
Yeah, like the medical field is like pretty small compared to like other fields. I think a lot of like high schoolers like that, when they choose their field or like what like they want to major in, they don't choose medical because of, like Arushi said, like the time commitment, like the 10 to 11 years, like you have to spend, and like you have to like spend like in college. But like, I think a lot of people don't understand that like the first 4 years after your bachelor's, like it's just like you said, you're like doing residency right now. So it's like just residency. So like, I would like you to like explain like is it really like do you not get paid, or like is it like college for like 11 years, or is it just like a job, like sort of like a job for like the resident?
Yeah, so I'll just take a step back and outline kind of the path to where I am now, and then just in general. So after high school, you go to basically 4 years of undergrad, and you major in whatever major you want, whether that's science related, non-science related. You can honestly study anything you want in undergrad, and still get into med school. The only thing you have to do is take a certain number of classes, the pre-med curriculum. So basically, your basic biology, chemistry, physics, biochemistry, psychology, sociology, those sorts of things. And then once you do all those things, you apply to medical school at the end of your 4 years of undergrad. And then medical school is 4 years. So the first 2 years of medical school is basically more courses you're taking, depends how the school sets up their curriculum, but basically you're in classes, you have lectures all day, you take exams, all those sorts of things. The second 2 years of medical school is really about being in the clinical setting. So whether that's the clinic, the hospital, you rotate through everything, and you kind of figure out what specialty you want to go into at that point, if you don't already know. Some folks come into medical school knowing what they want to do, and that's totally fine. I knew I wanted to do anesthesia, when I entered medical school, but a lot of classmates of mine didn't choose until the 3rd year of medical school. And then after, throughout medical school, you do not get paid. You're paying to be there. So that's where, a lot of the debt accumulates. It's very expensive to go to medical school. And then, after, 4 years of medical school, you go on to residency, which is basically an apprenticeship style training program. So, you're working with, fully board certified, for me, anesthesiologists, for other, specialties, they're fully trained doctors in that specialty. And so therefore you're learning how to, do that specialty, from these teachers basically. And so you do get paid during residency. It's much less than your typical, what you think of for a physician. And so it's, enough to get by, but at the same time, it's not the typical physician salary that you'll expect in the future. And so, you may be able to pay down your debts a little bit, but for the most part, you're going to be, just paying your basic expenses and saving most of your debt payments till later. So basically, if you add all those up, that's, depending on your residency, an average of 4 years for residency. That's 12 years of technically school in general. But the first 8 of those, you're not making any money. Then the last 4, you're making a little bit of money. And then after that, you can go on and, become, typically what you think of in terms of, a physician making, hundreds of $1,000s a year.
So obviously, as you have mentioned a lot, before I say anything else, I'm very sorry. This has been bothering me. My camera is not in the right place. Okay. So it's obvious that like money is a huge part of why a lot of high school students choose to pursue a career in medicine. And parents sometimes push for it because obviously after you pursue your education and you obtain your degree, it's very safe and easy to obtain a job. What would you say, so like as high school students are deciding what they want to do, when should someone be weary of like they're doing it just for money? How should someone know that they're not just doing it for money and that they actually like it? So where do you find that division?
Yeah, I mean, I think it has to do with, the individual. And, if you have a passion for science and have a passion for, for me, it was anatomy and physiology. I would look up how much a doctor makes in terms of money each year. But at the same time, I wasn't going into medicine for the money. I had, just a drive to, be able to, I guess, go through it and become a physician for other reasons outside of the money. The money's great. And so if you find that you're really, fixating on the fact that, oh yeah, I'll make a lot of money in the future. Or, I guess if your parents are making those comments about, oh yeah, you'll be financially stable and, all this, that's when I kind of, start thinking about whether or not it's, because of the money or because you're actually interested. It is a ton of work. I don't want to, underestimate, the amount of work you have to put in. You're basically losing your entire decade of being in your 20s. Because if you, go through it straight through everything, you typically finish your training around age 31, 32, depending on what specialty you choose. And so, you're working a ton of hours in medical school, whether it's studying or in the clinics, and then you're also working a ton of hours as a resident, sometimes up towards 100 hours, depending on the specialty, 100 hours per week. And so, you basically lose a decade of your life. It's possible to do kind of life events, getting married, having children during these years. However, it's very difficult. And so, that can put a strain on your training as well. And so a lot of folks will wait until they're done training and then, they'll, start having families and everything like that. So when you think about it in terms of those ideas, if you're okay with giving up, basically the 20s of your life, then, I think it's okay. And, I justified that with the fact that, I'll have a long, very nice career after that. And so that never really bothered me, but, I think for some folks it might. And so, I think you really have to figure out if you're passionate enough to give up all the time, give up all the, kind of life stuff that you may not be able to do. You'll miss out on weddings, you'll miss out on family events, you'll miss out on, a lot of stuff. And so if you're okay with all that, then that's great. And, you're headed on the right path. But if you're having reservations about that, then, maybe medicine's, not the right career. And, there's a lot of medical a lot of medical jobs that, don't require you to become a physician. And so, they take less schooling, they take less training, they take less time. And so you can always pursue one of those and still help people in the medical field. But you just, may not be, the physician.
Yeah, sure.
Yeah, so like, do you think, kind of like a follow-up, do you think people who go into medicine after they finish the training and when they get a career, like a stable job, do you think it's what they expect it to be, or like any big differences in what they've thought it was to be? Like, expectation versus reality kind of thing here?
Yeah, yes and no. I guess it depends on your field. You know, it's really hard to know what it's like, you know, until you go through it. You know, I'll use myself as an example. You know, I talked to a lot of people, you know, when I was a pre-med. I talked to a lot of residents, you know, and you know, try to get a grasp of what it's like. But, you know, until you go through it, it's really hard to imagine, you know, saying, you know, no to seeing your friends, saying no to saying, you know, seeing your family, you know, over and over again. You know, that becomes difficult after a while. And so once, you know, you're done with training and everything, you do have a little bit more freedom in terms of, you know, typically your schedule's a little bit lighter. So, you know, you're able to do all those things. And I think there's another important thing, you know, in terms of, you know, the medical field and in terms of it's, you know, there's a lot of moving parts in medicine. You know, insurance companies, you know, don't want to pay you for things. You have to always justify, you know, why am I doing this? You know, why does the patient need this? You know, those things come up all the time. And you know, if that's your life, it can be very draining. And so, you know, in terms of expectations versus reality, it's not just, you know, always an easy thing. And, you know, some doctors make it look really, really easy, but it, you know, it's difficult. And, you know, you have long days, you have long hours. And so, like I said, it's really hard to exactly know what it's like until you go through it. And that's why I think, you know, some physicians get, you know, kind of burned out and they get tired of it and they get, you know, to the point where they may, you know, want to quit medicine at some point. And so, you know, there's almost no way to prepare for that, to be honest. You know, you just have to do your best and have the right mindset going into it.
So on the topic of like expectations and reality, like everything you just said was my brother's currently he's in his 4th year of his bachelor's and he's going on to become a surgeon. And he like in high school he would talk about like what he was concerned for, but like his entire mindset was based on the money of everything. He's like, I'm gonna make so much money of this. And like throughout from like freshman year to senior, he was talking about like how much he's gonna make. And my parents were like, okay, calm down, like that's fine, because that's his only reason that he wanted to become a doctor. And as he went through college, like he realized that this is like I think I don't know if this happens to everyone, but he realized that how much he enjoys what he's doing, because now
Sure.
obviously there's a huge emotional aspect of it that he works at a hospital right now and we can't see him because of that. So like every time we see him it's from a distance and whatever. But like he realized how much he likes the work. So he drifted from that expectations. It was almost like his expectations were reality. And so I think like for a lot of high school students that might seem scary, but as you already talked about it, like the work can be satisfying. So that's good to know.
Yeah,
so completely shifting away from that, can you talk about GetAdmittedMD and what you do?
Yeah. So, like I mentioned before, GetAdmittedMD is a company that I started back in 2018 based on my experiences on a medical school admissions committee when I was in medical school. So I served 2 cycles, you know, and I was a full member of the admissions committee at the University of Iowa. So I reviewed hundreds of applications. And what I had found was that, you know, there's some really great ones, there's some really, you know, not so great ones, and then there's a bunch in the middle. And so, you know, I think it really comes down to education about the, you know, what medical schools are looking for, what they're interested in seeing in the applicants, and you know, really preparing, you know, students in terms of you know, making sure their application is up to par. You know, you could get, you know, really good grades, really good MCAT score, but at the end of the day, if your application is not, you know, where it needs to be, you could still not gain acceptance. And so, you know, I really like to work with students and make sure they know the process in and out so that they know what to expect. So I take them take them through the entire process from, you know, writing their personal statement to putting their application together, doing mock interviews, you know, the secondary essays, which is a component of the application process. I go through those with them. And then I kind of answer any questions along the way and serve as more of an advisor in terms of, you know, if they do get multiple acceptances, which I hope everyone does, you know, I kind of talk them through, you know, maybe I would choose this school over that based on what I know at this point and you know, what I've heard from, you know, working in residency. And maybe I know someone that went to that school, and I can reach out to them and really be able to give them a sense of what it's like to be a student there, and just basically walk them through the entire process, from being a pre-med to accepted to medical school.
So obviously we're going to link your website in the description of our video. How can someone get in contact with you if they're looking to work with you in terms of their admissions?
Yeah, so my email is probably the best way. So my email is david@GetAdmittedMD.com. And you guys can put that in the description as well if you want. But yeah, they can shoot me an email, and I'd love to set up a call and talk with them and see how I can help them.
Awesome. So I saw an article, I think it was on Yahoo Sports, I don't know. There was an article about what you do. The article talks about some of the challenges that students pursuing medicine face. What do you think is the biggest challenge that students face when applying to medical school or college in general?
Yeah, so I think it's just, the overwhelming amount of things that you can do. Both before going to college and before going to medical school, to prepare your application. So the amount of clubs you can join, the opportunities out there these days are just so, immense. And so being able to know, what would make a good activity on your application, what maybe, you should, maybe stay away from, those sorts of things. And then, being able to choose, kind of what you're interested in, not just what checks the box. And so there was this notion about, at least medical school admissions, that you had to do research, volunteering, shadowing, you name it. And I think students fell into this trap, and I fell into the trap years ago of, trying to check those boxes versus just doing what I was interested in. So, I did research in a biochemistry lab, as an undergrad, where I was working with E. coli bacteria and, DNA replication proteins. And, I look back on that experience, and, some days I'm just like, why did I do that? And, I basically was checking the box, to be honest. I wanted to do research. I wanted to find out, what that was like. But did it, help me in, my career today? Not really. It allowed me to learn a little bit more about the research process and the scientific method and everything like that. But at the same time, I was just checking the box, which isn't always the best thing. So I always, try to, have students find what they're most interested in, and encourage them to pursue that, because when you're in an interview setting, you're going to be able to talk much more passionately about something you're interested in, versus, when I talked about DNA replication proteins, it didn't really, excite me that much. So I was just kind of regurgitating what I knew instead of, being able to talk about it and show that passion. So, I think for the college admissions process as well, just find something that you're really interested in and, run with it and, kind of dive into it. And that'll come off way more, interesting. That'll come off way more, I guess, genuine, if you will, in terms of your college admissions process as well. And so, I would say that those, just being able to choose the right activities and, be able to put together your application is quite a challenge these days.
It's really important that you say that, especially in this interview. We go to a very competitive school district in a sense that people obviously academically and very STEM-based competitive, but there's also a sense of like the whole well-rounded discussion has been drilled into our brains ever since we've entered like the end of 8th grade.
Sure.
And like you have kids doing like filling their schedules up with clubs and random charity events, this that they're not interested in, but they need something to put on their application for whatever they're trying to do. You can talk about high school or before medical school. What experiences or activities benefited you the most? What activities benefited you the least? And or whatever in between you think overall that necessarily didn't relate to medicine, but you still found it useful.
Sure. So I think one of the most beneficial experiences I did before medical school was I was actually a teaching assistant. It was actually a year position where I taught or I helped teach physiology classes. And I think that really helped me because, as physicians, we're teachers, no matter if we like it or not. We teach patients, we teach family members, we teach medical students, we teach, basically everyone, about certain aspects. And so, being able to take a, very complex topic, such as putting someone to sleep, and basically explaining it in a way that the patient understands it, the family members understand it, and they put their trust in you to do so. That can take some skill. So being able to look back upon that experience as a teaching assistant really helps. And so I think that was one of the most beneficial. I think I touched on this a little bit already. I think the research that I did in as an undergrad was a little bit, maybe it was great, don't get me wrong, but at the same time, it wasn't necessarily the most helpful in terms of, being able to prepare me for the future. It was really just to check a box, and that was really about it. And so, looking back, I wish I had something that was maybe a little bit more, maybe I would have went to anesthesia research or physiology research or something that was a little bit more applicable. But at the time I was really just searching for any kind of research so I could put it on my application. And, to be honest, for the college admissions process, I didn't really do a whole lot in terms of, prerequisites or anything like that. It wasn't that competitive back then to get to a great undergrad institution. It's just gotten more and more competitive over the past, 10 years. And so, I didn't really have much on my application to college, to be honest. I wish I did. I maybe could have gone to a better school or a different school. So, but I could, see how it would be very, competitive these days. And, you almost have to prepare for college like you prepare for medical school. You have to have some sort of extracurriculars. You have to show you're interested in something. There's way more essays now than there were when I applied to college. So, all those things make it a much more difficult process. And so, I think the bottom line is, try to do something that you're interested in. You may have to do a few things that you're not so super interested in, but if you can focus like on 1 to 2 activities that you're really interested in, like what you guys got going here is awesome. And I think it's, if you can really develop this and be passionate about it, this will serve well on your application to college, and show that you're really interested in in medicine already, which is great.
I think also, as we were talking about this, I realized the difference between like preparing for high school admissions and preparing for medical school admissions is that in high school you're doing things to look well-rounded, while in preparing for medical school you're doing things that you want to focus on and that you're interested in a sense. Like before. Oh, you seem to be shaking your head. You're like,
well, I mean, you still have to be well-rounded in terms of applying to medical school. You should have you can't just have one activity on your application and say, oh yeah, I'm gonna get in. You do have to have some sort of well-rounded nature to it, but I think it's less than maybe getting into college in general. And so I think it's I focused on anesthesia as a pre-med. I worked as an anesthesia technician in the hospital. Like I said, I did the research in biochemistry, and that wasn't really related to anesthesia at all. But at the same time, I kind of had some sense of what I wanted to do, versus, when you apply to college, you may not have a sense of, what you want to do. So you then need to be the well-rounded individual that does, volunteering and, all these other things that go into the college application. So, you still have to be well-rounded as a medical school applicant, but at the same time, it's just a little bit different. It's maybe a little bit less well-roundedness and a little bit more focused, but not completely, not well-rounded.
So essentially, no matter what stage in your like education you're applying for college, it's always good to look well-rounded, no matter what.
Mm-hmm. Yeah, I would definitely say so.
So I have a question. It has a couple parts. You can be as vague or general or brief or whatever you'd like, how you'd like to advise. So what are the first steps someone pursuing medicine should take, like our age between 9th and 11th grade? What are the first steps a senior in high school should take? And what are the first steps someone applying to medical school should take right now?
Sure. So I'll take it step by step. So 9th through 11th, really just get a good solid foundation for how you're going to study, what makes you successful, in terms of, do you do flashcards? Do you do practice questions? Do you have to read the chapter ahead of time? Just figure out all those things as a high schooler. And I think that, that definitely helps in terms of the academic realm. Obviously do well in your your SATs, everything like that. And make sure that those, scores can allow you to then go on to, good schools and, kind of, keep the momentum going, if you will. As a senior, then you start kind of looking, more at what college will set you up for success later on. If it's the state school that, has a great medical school that you want to attend, that's what I did. I went to a state school, but, I knew I wanted to go to their medical school down the line. And so, I kind of set myself up to attend that school for undergrad so that I could start working in the hospital, gain some connections there, and hopefully make it to their medical school, which, it worked out. It doesn't work out for everyone. But at the same time, it did work out for me, which was, very lucky. I think the other thing that's really important these days is figuring out if you're a big university type student or a small college type student. So do you need that close knit, interaction with the, with your teachers and professors? Do you need that, in order to succeed? Or are you okay, maybe studying on your own a little bit more and, therefore going to a big university where you're going to be one of 300 to 500 students in some classes, in giant lecture halls? Post-pandemic, obviously. But at the same time, those things are important and you need to be able to distinguish what will make you the most successful. And so, kind of putting those pieces together, I think are important. Obviously as a high school student, being able to, get into a good college will set you up for a great, kind of path in the future. I'm not saying, pedigree of what college you go to is everything, but it does open some doors later down the line. And so I think just, being able to think ahead a little bit, if you want to go to a, specific region for medical school, sometimes it helps to go to a college in that region. That way you're kind of there already, but at the same time, if you want to go to a medical school all the way across the country, that's totally fine too. It happens all the time. So in terms of applying to medical school, as an undergrad, I think, just developing your application early, knowing that you're, potentially interested in medicine and getting those things on your resume early, but not before you kind of set your solid foundation as an undergrad student. So, I made the mistake of, kind of getting involved in too many extracurriculars early. I started working in the hospital in my first semester of undergrad. I, started volunteering my second semester. I didn't do the research until like my third year. But I think if I had, developed a little bit better of, maybe study habits or, had more time to focus on, those early courses in undergrad, my GPA might have been higher, and so I think a lot of students want to, get involved with as many things as they can, as a freshman in college. And, I would say, pump the brakes a little bit, maybe, do one or two activities your first year and then kind of build from that. Because, you definitely want your GPA to be, very high to apply to medical school. And so, the best time to set that foundation is your first year. Because as you progress through your college education, you'll have less of an effect on your GPA as you accumulate more credits. So, you could do, really well your first semester or your first year in college and, really have a good foundation. And even if you have one bad semester later on, it won't really affect your GPA that much because you have built up those credits. Versus if you're playing catch up and you have, low GPA, your first two semesters, it'll just be an uphill battle from there on. And so I think just really getting off to a good start is really crucial for your undergraduate years.
Absolutely. Just to close things off, we already touched on this, but just to wrap everything up, the journey is very long, obviously, and this can be as profound as you like, by the way. It can be as profound as you like or as critical as you like. The journey is long. Do you think it's worth it, and what makes it worth it?
Yeah, so personally for me, I would say it is worth it. I can't see myself, doing anything else in my life. And that's what kind of, makes the decision for, whether or not it's worth it. So if you wake up and you're like, I want to be a physician no matter what, it doesn't matter if I have to give up, 10 plus years of my life, to basically schooling, training, everything like that. I think it comes down to enjoying what you're doing. So, I found anesthesia, I was lucky enough to, match into anesthesia, for residency, and therefore, I really enjoy it. There are definitely physicians who don't necessarily enjoy 100% of what they're doing. And so that, answer may change based on whether or not they enjoy what they're doing. But at the same time, I can't really think of anything else that I would rather be doing on a daily basis than, being a physician and, providing anesthesia and, taking care of patients in that manner. So to me, it's worth it. And I think, has it been difficult? Yes, definitely. Have there been days when I, had to work 24 plus hours straight? Yes. And so, yeah. So, it's those things that kind of make you question it. But at the end of the day, those are not every day, at least in anesthesia typically. And so it's, it's been great for me. And so, I would say it's worth it for me. But, once again, I can't answer for, other physicians.
Awesome. Sorry, somebody just messaged me something.
Sure.
Okay, so Shivaji has some closing thoughts. Shivaji, back to you, Shivaji.
Yeah, I just wanted to thank you for your time. I, for one, learned a lot.
Sure.
Yeah.
I'm pretty sure the other high schoolers who listen to this, they might change their perspective on medicine,
Sure.
maybe not attend as many clubs, even if they're not interested.
Yeah.
Yeah. So is there anything else you'd like to add?
I guess in general, every stage of the process gets a little bit better. So, it can be really overwhelming when you're kind of looking at this mountain of a journey that, if you're going to pursue medicine, at your stage, it's going to seem like, this world of, uncertainty, and you don't know if you're going to make it to medical school and everything like that. And, there may be days along the way that, you don't know if you'll make it to become a physician, and that's totally fine. I will say that it does get better at each stage of the, kind of the game. So, as an undergrad, it gets better. Once you make the medical school, obviously, you feel better about the whole process. And then when you're in residency, you finally kind of get that sense of, I've been doing this work for 8+ years now. This is what it's all about. So, I think just having that mindset of, it does get better. There will be some hard days, but, kind of at the end of the line, hopefully, you find it as worthwhile as I have. And so, I think just kind of keeping your eyes on the horizon is super crucial.
Awesome. First of all, thank you so much for doing this. I hope we didn't take up too much of your time. This was a really great interview. Your answers are super thorough. This will definitely be helpful.
Sure.
Yeah, thank you so much. This was awesome.
Of course. Thanks for having me.
Yep. We're going to stay on the call because we're going to do a little meeting after, but you are free
Awesome.
to leave. And thank you
Awesome.
so much.